We're going to take a second real quick. Is Brittany here? I don't see Brittany, but we're going to start. Oh, there we go. We got recording started. All right. Go ahead, Joan.
Okay, so we have Brittany Collins Jefferson. See her yet. Okay. Lenitra Grady.
Good morning, present.
Ryan Gustafson.
Present.
Dr. Kamyar.
Present.
Carissa Loper.
Present.
Catherine Loudon.
Morning, everyone. I'm here.
Cecilia Maria.
Present.
Elise Monroy.
Present, sorry, too many screens. Present.
Darcy Patterson is absent, excused, and so is Pauline Sala. David Sanchez.
Present.
Ariana Saunders. Cornelius Sheehan.
Present.
Dr. Carla Wagner.
Present.
Okay. And Quintella Winbush.
Present.
And Joan Ariana Saunders is here. I'm not sure if we
Okay,
got her, but
okay, I will mark
Here
her
now.
present. Thank you.
Thank you.
all right. We have quorum. And as we continue, I just wanted to mention that there's a vacancy on this committee. The Nevada Office of Minority Health and Equity is currently recruiting a member that represents a program which specializes in the prevention of substance use by youth. And they do have some people that have submitted their information for that position, and the recruitment closes tomorrow. So we will be getting an additional member because we lost one. At this time, I will move us to agenda item number 2, which is public comment number 1. Public comment will be taken during this agenda item regarding any item appearing on the agenda. In consideration of others who may wish to provide public comment, please avoid repetition and limit your comments to no more than 3 minutes. Again, no action may be taken on a matter discussed under this item until the matter has been added to the agenda as an item that at that time action may be taken. First, public comment. I see we have one hand raised. I can't actually see who. Oh, there we go. Terry Kerns.
Hi, thank you, Chair, for allowing me to address the ACRN. I just wanted to provide an update on the meeting from the statewide substance use response group, the SURGE, that was held yesterday. And I'll be brief in that. We also had to introduce a new member because someone had to resign. We received an update on the opioid litigation, settlement funds, and distribution. And then the majority of the meeting was spent on trying to consolidate and present the recommendations from the SURGE from our 3 subcommittees. And the 3 subcommittees are the prevention to include harm reduction subcommittee, the treatment and recovery subcommittee, and the response subcommittee. We did find that we had some overlap on a couple of the recommendations. So each of the subcommittees has been tasked with taking the feedback that was received in yesterday's SURGE meeting back, and we're going to, each of the subcommittees will have another subcommittee meeting to finalize their recommendations, which will then be brought forth to our larger SURGE meeting on December 14th at 9 a.m. Everyone's invited to attend those. Those are all open meetings. and then to finalize our report that will be presented at the end of January to include those recommendations. And that was really the main part of the surge that we held yesterday. So if there's any questions, I'm happy to take them. I don't know if that's allowed in your public comment or not, but that's my update.
Great, thank you so much, Terry. We are not going to take any questions during the public comment portion of this meeting, but I do appreciate you showing up and giving us an update. Thank you for taking the time to share with us. I have Don Yohey for public comment as well.
Good morning, everybody. Dawn Yohey, DHHS. I'm going to be reading a statement from Dr. Stephanie Woodard to put into public comment. She unfortunately couldn't be here today. She got called away. This is in regards to a joint advisory committee task force to address emerging trends in the opioid crisis. So the governor, attorney general, and director of DHHS are calling together a joint committee task force to address the emerging issues that we see across our state with increasing rates of fatal and non-fatal overdoses. The joint committee task force will convene the Attorney General's Substance Use Response Working Group, the SURGE, and the Advisory Committee for a Resilient Nevada, the ACRN. Both groups are statutorily defined and comprised of subject matter experts across public health, behavioral health, law enforcement, and prevention, as well as individuals with lived experience. The SURGE also has appointed elected officials. Both groups have been diligently identifying needs and strategies to put forward recommendations to address the opioid crisis over the past year. We think of no better group currently poised to take with determining immediate interventions to position our communities in a stance of preparedness to reduce further potential overdose increases and to respond in the event such a spike occurs. We are currently completing a state plan for the allocation of the Fund for Resilient Nevada funding and preparing for a December IFC for moving available funding into categories where we can begin to spend to address both immediate and longer-term solutions to address the opioid crisis. However, the need to convene and begin taking action is now. Nationally, in neighboring states, we are seeing troubling trends in overdoses resulting from increased infusion of fentanyl into the illicit drug supply and increasing rates of youth fatalities from overdoses. Additional details on the joint committee convening will be forthcoming.
Thank you, Don. Thank you for giving the update from Dr. Woodard. I'm always happy to hear what she's working on and to get information from her. Do we have any other people in attendance that would like to give public comment at this time? There's a feature where you can raise your hand up at the top. It's under reactions if you are interested in speaking as part of public comment. And I'd also like to remind attendees that if you could keep yourself on mute until you've been called on to speak, that would be really appreciated and help keep everything moving smoothly. At this time, I do not see anybody else interested. Oh, there we go. I have Catherine Loudon for public comment number 1.
Yeah, I just wanted to say, especially in front of this group, that it would be very helpful for us working in the schools and all of us doing this aligned work if we could have the official release of the Youth Risk Behavioral Survey results from 2021. So our state is compiling the CDC and state of Nevada results, and several groups are working on this. However, us working in the schools and our fellow community organizations have not formally received an official copy of the results. And as a school district, we'll be getting ready to gear up for the 2023 administration of the Youth Risk Behavioral Survey with less than a year's worth of data to even use as something that we can move forward with. So I just wanted to put that on the record and let you know that that is something that we're all still waiting for.
Awesome. Thank you, Catherine. It's a good space to let it be known that you're looking for some information that has been worked on recently. Hopefully we can get somebody to connect with your agency and the agencies that are looking for that information out of this. Do I have anybody else for public comment number 1? Looks like I see. Nope, still Catherine. Catherine, at the same place in reactions, you can click the hand button to lower your hand. And then I think that's all we have. Thank you so much for doing that. I think that's all we have for public comment number 1. So I am going to move forward to agenda item number 3. In this agenda item, we have for possible action, the approval of the minutes from the August 17th meeting. These were posted on our ACRN webpage through the state. I would say a couple weeks after we met and have been passed out to individual members also. Do I have anybody that is able and interested in making a motion? And before I get that motion, I'd just like to cover that at the August meeting, the Chief Deputy Attorney General Mark Kruger explained why the litigation funds will not be used to compensate individuals. Dawn from the state also shared that the rated recommendations that this committee sent to the director's office for consideration in prioritization, we accomplished that. And she also gave us an update on the state plan. And I reviewed what we accomplished as a committee. So we have anyone that has gone over the minutes, is interested in moving forward a motion?
I'll motion. This is Carissa Loper for the record. I'll motion to approve the minutes from the August meeting.
Thank you, Carissa. Do we have anyone with a second?
This is Ariana Saunders. I'll second that.
Thank you, Ariana. Joan, is this a one that we need to vote to approve or okay?
Yes.
We're going to vote to approve the August 17th meeting minutes as a committee. At this time, can I get the committee members to unmute themselves and vote if they are in favor of approving the minutes from August 17th?
Aye.
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 All right. All opposed to approving the minutes from August 17th, if you're a committee member, please unmute yourself and give us your vote. And finally, do we have any abstentions from voting to approve the minutes from August 17th by committee members? Now is your time to unmute yourself and give us your vote.
This is Cornelius Sheehan, abstaining.
Thank you, Cornelius. Looks like we have the motion approved to get those minutes approved from our last meeting. And we will move on to agenda item number 4. In this agenda item, we have an informational presentation on state opioid response tribal needs assessment from CASAT. This CASAT is the Center for Application of Substance Abuse Technologies, and they're going to provide us a presentation on the SOAR tribal needs assessment. Looks like Karina.
Hi, good morning. Sorry.
Oh, there we go. Morgan.
My name is Michelle Berry. I'm a senior project manager at CASAT. And with me today, I have Karina Rivera, who is our SOAR program evaluator, and Morgan Green, who is one of our program coordinators. And so Karina will be going over the needs assessment that was conducted. And I think at the end of the day, when all is said and done, what you'll see is that more information does need to be looked for and gathered, but this does give us a baseline for information that currently exists. So I'll turn this over to Karina. And then do you want us to share our own screens, or we did send this over to Joan?
You can go ahead and share your screen.
Okay, great. Karina, I'll turn this over to you.
The share is not highlighted, like I can't.
Oh, okay. We are unable to share.
Yep.
Can
Share
someone guide
is
us through the
disabled.
presentation, please?
So is someone going to turn that on?
Yeah,
One
give us
moment.
one
I'll
second.
get
I
it.
think
Yeah.
Joan is the only one that can share right now. So just give us a second.
Okay. Thanks for having us today.
Yeah, we're glad to have you. Thank you for being here.
And then I wanted to also say that, so CASAT does facilitate the state opioid response grant on behalf of the Division of Public and Behavioral Health, SAPTA. So we are a recipient of funds and then help to administer that and provide direct funding to community members. So our program officer from SAPTA, Heather Kuhn, is also on the line with us today.
Awesome. Thank you. Carissa, it looks like we have your slides up. When you're ready, if you just want to give the signal next slide, we can move you forward and through your presentation. Sorry about the technical difficulties.
Okay. Do you want to maybe just put it in play mode so everyone doesn't read all my notes?
Boom.
I'm looking for play.
It's in the bottom right-hand corner, the little, do it.
Right-hand corner.
Yeah, a little bit over, you were right next to it. Now just a little bit over that first symbol. There we go.
There we go. Okay.
Okay. Okay, so SOAR was required to do a tribal needs assessment, but we didn't really have, as you probably read, any particular guidance or stipulations of what the needs assessment had to contain in it or what we needed to look at. Next slide. So here is kind of an assessment timeline of what we did to undertake this needs assessment. And so we started with trying to work with DBPH on what they already had to know as a starting point. So the tribal liaison had recently done a whole statewide tour, talking to each of the tribes about their needs. But we wanted to see if any other tribal needs assessments already existed, but DBPH, DHCFP, and Office of Analytics said that they did not have any. So then I went through and did a needs literature review to see what other tribal needs assessments were using as the indicators and methods for theirs. We met with Project Echo because they were also looking to do a tribal needs assessment to see ways in which we could partner. Then we met with Dr. Lucera over in the School of Public Health because she has experience working with tribal communities to see if she could provide us any guidance since we did not. But since she was newer to Nevada, she didn't have connections here for us. So then we went and met with the Council of the State and Tribal Epidemiologists to discuss, what type of other assessments they'd done, the methodologies, approaches, connections. And really what they said was, with COVID being such a competing priority for all these health clinics, they didn't think that we would get much engagement from the tribes at that time. So that's when we decided for this particular assessment that we would be sticking with secondary data. So we made a request from Medicaid looking at claims. We also then made a request from the Office of Analytics for the different indicators we'd found in our assessment. Oh, also we had discuss with Overdose Data to Action Grant if they had anything that they were doing, but that's out of their scope of work. Next slide. So as I discussed, I did a literature review and found that 2 other opioid-specific tribal needs assessment, 5 other substance use related tribal assessments, and then 3 other ones that went broader into other health needs besides substance use. Next slide. They used a variety of indicators and methods, but based on what multiple states had looked at and such, I chose to look at these ones, these indicators. Next slide. So the few of the data we were able to compile, this is looking at, in the gray, we have the percentage of American Indian and Alaska Native individuals in Nevada who have an opioid use disorder diagnosis. In yellow, that's those who are seeking outpatient treatment. And then in blue, that's those who are on medication-assisted treatment. So in the gray, it ranged over the 6-year period from 1.1 to 1.3% of those diagnosed were American Indian or Alaska Native, which in the state of Nevada, it's 1.2% of Nevadans are American Indian, Alaska Native. But then you can see much lower percentage of individuals who are in treatment. Next slide. A quick note on access to medication-assisted treatment. These orange markers mark the Indian Health Service centers that exist in Nevada. Of these 14, only 4 of them offer medication-assisted treatment. 2 of those 4 happen to be tribal opioid response grantees. We also found that there was not a ton of access to, at least in-person, AA, NA meetings. So it was mostly virtual options, although we were also looking at a time of COVID. So that could also be part of the reason that there was mostly virtual options. Next slide. We looked at inpatient admissions in the hospitals at opioid poisonings. Because the numbers were so low, the rates were not reliable. So we lumped together years to help with that. And so it was kind of pre-opioid funding to during opioid funding. And you'll see the navy blue is the American Indian Alaska Native, that the rate did go down, but is still the 3rd highest. Next slide. Also emergency department visits. Again, they're navy blue. There was a decrease and they were still 3rd highest. Next slide. Overdose death rates only decreased very slightly and is 3rd highest. Next slide. So from here, since we only did secondary data collection at this time, we would still like to find some potential method of primary data collection and speaking and gaining feedback from others. So we're going to try to get on the next opioid or the tribal consultation meeting and discuss, and then also talk to statewide groups such as yourselves for suggestions on what would be the best next steps or where we should move forward from here. And that is it. Questions?
Did we have any questions for the CASAT team?
Hi, this is Lenitra. I do have a question. I believe on either your second slide, you mentioned that you were in collaboration or you reached out to Project Echo back in 2020 about their needs assessment. Have you guys reached back out to them? Do you know if they did any primary data collection?
Michelle, do you know?
So there was no primary data collection that was done during this time, but I haven't seen the full needs assessment that they have come up with, but it was also looking at different variations of training. So we can reach back out and then provide this group with additional information.
Thank you.
Sure.
Do we have any other questions for the CASAT team? All right. Thank you so much for joining us and taking the time to put together a presentation and really giving us an update on what it looks like as far as where opioid response and the Native American tribes of Nevada are currently at, and what it looks like, where we're going to go, where we're going to need to go moving forward to support this population. It's important that we keep in mind that there are some groups that are marginalized that we really need to continue to keep at the forefront of what our response is going to look like and how our expertise as committee members of this committee can help drive and move that forward. So your time and effort is very much appreciated. Thank you again. If we have no further questions or comments for this portion of the meeting, then I will move forward to agenda item number 5, which is another informational agenda item with an update on progress with the Fund for Resilient Nevada State Plan, and Dawn will provide us an update. Dawn?
Thank you. Dawn Yohey for the record. I can't share my presentation and Joan doesn't have it, so I'm just going to kind of read you guys a little bit about where we're at with the state plan. As we were developing it, we were developing a separate document for the needs assessment, which is already on the website, and then the state plan. But as we were developing the state plan, we realized like it really fits into the needs assessment. So it's all going to be one document because there's a lot of really good information in the needs assessment that flows into the state plan. So as we were developing the state plan, we were like, why are we copying all of this information over here when it's already over here? So it's going to be a separate section. And really the state plan establishes a system of accountability for the allocations of the Fund for Resilient Nevada to target priorities that were are established by the statewide needs assessment. So it all flows together. The statewide plan is going to be comprised of goals, strategies, objectives, and activities, and these are derived from the recommendations that you guys prioritize that are in the state plan. So you're going to have priority ratings on there with each activity, and so you'll see that it's very clear. The strategies include infrastructure and capacity development to ensure local and community partners have the capacity and the resources to be able to implement recommendations effectively and sustainably. Oftentimes what you're seeing is, projects are funded and raised and then they end up going away. What we want to do is really fund a project and make sure counties and communities are able to sustain projects. The structure of the goals actually align with the national efforts of the Office of National Drug Control Policies, National Drug Control Strategy. You'll see 7 goals in there, and again, broken out with all of the recommendations that you guys have prioritized in there as they fit. The plan is going to be serving as a dynamic or a living document. So once you get a draft, it doesn't mean it's just, it's a final and this is all we're going to be funding, but it really is going to encompass a big picture, a much larger picture. And some of the things that are in there are being funded with other federal funds or other state funds already, which is why we're also doing this continued mapping of opioid funds throughout the state. As more funds become available and data is available, the state will update the strategic priorities to ensure that all of the funding priorities are data driven. And what we're funding is, evidence based. And so those are all things that are going to be shared with you guys. Some of our current and future steps are mapping, like I said, of the opioid funds in the state to make better investments in communities. The director's office is currently completing project and fund analysis review of not only opioid funds, but substance use funds throughout the state, and how key funding streams are invested, what's working, what's not working. Project mapping and planning assists with bringing information together across agencies and departments to not only shed light on the amount of funds that are being invested in key services, but also on how effective they are and how to align those investments with other priorities in order to improve outcomes. So I'm happy to take any questions. It's going to go to peer review here in 3 weeks, and so we should have a copy for you guys shortly after that. And again, not a final document. If you guys see it and you're like, hey, yeah, this looks weird, and you know, this isn't in here, you know, bring it to our attention, and we can go back and look and see, okay, why didn't it fit, or why does it fit, and why we're going the direction we're going. So
Awesome. Thank you, Dawn. I appreciate that. Yeah, so this is going to be part of our work that we do as a committee. You know, after we finish this agenda item up, we'll talk about our next meeting, but being that we ought to see something before we meet in December, I want to ask the committee members to take some time to review what is being sent out and give feedback. And also, you know, if you have questions, send them in, but if you don't have questions, just feedback in general, so that when we meet in December, we can get kind of a generalized idea of how the committee feels about things are going so far and the direction that the state is taking. That's, you know, part of our role here as the committee. Do we have any questions right now for Dawn? All right, I don't see anybody's hand up or anybody unmuting. So again, thank you, Dawn, for giving us that update and all the work that you and your team are doing. It's a lot, and appreciate it. At this time, we will move forward to agenda item number 6. This agenda item is a notice of the dates for the upcoming ACRN meetings. Again, we have been directed to hold a joint meeting with the Surge Committee. That's our counterpart office of the Attorney General's office. And an invitation will be sent out as soon as a date and time is confirmed. We're supposed to have this done by the next Surge meeting, which is December 14th. So I really need committee members to do what they can to make it to this meeting. It'll be a good opportunity to get some clarification, ask questions, and kind of share what it is we're doing, and kind of, again, this is our counterpart committee group. So if we could just do the best we can to attend this meeting would be awesome. This meeting will be held in November or early December, before the busy holiday season. And again, their meeting is the 14th of December. So we're thinking it'll be the last week in November or the first week in December. As far as this committee's meetings go, we're going to set the next next meeting in December, the same first Tuesday of the month at 10:30. It seemed to work well for the committee currently, but I would like some feedback from the committee as far as, do we want to continue moving forward with the first Tuesday of the month at 10:30, or are we looking to have Joan send out a doodle poll for December? And I know it's a lot to ask to plan for next year, but moving forward through the 2023 year, as you see your calendars today and this next couple of months, do we want to keep the first Tuesday, or are we interested in seeing a poll to adjust our meeting times? Does anybody from the committee have any thoughts on this?
Where's my hand?
I have Cecilia Maria, Carla Wagner, and Cornelius. So let's start with Cecilia.
First Tuesday is great. That works fine with me.
Awesome. Thank you so much, Cecilia, for speaking up.
Mhm.
Dr. Wagner?
I would appreciate a poll because it'll be a new semester and a lot of things are going to change for me. I will do my best to get all my permanent things on the calendar, but I would appreciate a poll.
Okay, now is that for December or moving forward through 2023?
In the next year. Through
Okay, so we're
2023.
good for,
I'm good for this
Okay, good.
semester.
Awesome, awesome.
Thank you.
That's, I think that's the kind of clarification that we're looking for. And then, yeah, we have some time to get it set for 2023, but thank you for sharing. Cornelius?
I'm with Dr. Wagner on that. That would be great to have that. And then I'll make adjustments. So the Tuesday, I missed the last meeting. The Tuesdays work best for everybody, huh? That's what was decided. Okay.
Right now, it seems to be flowing pretty well, but I think we do need to review it so that we can get, I just feel like there's gonna be some wiggle room where we can come up with a day that's gonna work for everyone, but everybody has a busy schedule and we definitely don't want to ask people to miss their, work that they have that they can't rearrange. So we'll get the doodle poll out there for 2023. But again, I appreciate you guys showing up and
Appreciate that, Mr. Chair. And also, and pardon me, I'm sorry, did I interrupt you?
no, you're good. You're good. Thank you.
Thanks. With regard to that late November, early December meeting, if we could do the early December, that's a preference I'd have. So that would be like December 6th, I think. Was that Tuesday, right? Yeah. December 6th was first Tuesday.
Yeah,
Yes.
that'll be our ACRN meeting and we'll do that at 10:30. But
Oh.
for the joint meeting, they're looking at the beginning of November, it turns out, not the end. That was my
Okay.
mistake. I was looking at the wrong thing. So
Gotcha.
the joint meeting between Surge and ACRN is likely to be set for the first week of November, but I don't think we have anything hard set yet. So we will be
Oh.
sending out an email with that information in the next week or so.
Okay, yeah, that would be great. On my end, it ends up necessitating moving my clinical schedule around. And those of you that have a clinical schedule can empathize with that difficulty. So.
And I think that's one thing that the state team and myself and keeping in consideration as we look to set future dates is that I think the most sensitive out of our committee members and making adjustments are the committee members with clinical clients. Exactly.
Okay, thank
So
you.
I'm working on it. We're definitely trying to narrow it down, and we'll try to set it so that next year we have like a consistent, so you don't have to make changes throughout each month or every other month.
That's great. Thanks so much.
Yes, thank you. Oh, all right. Well, it looks like I don't see any other hands up for talking about our next upcoming meeting. So again, I would appreciate it if you can do the best you can to make it to the joint meeting that we're planning in November. Sorry for the miscommunication and misunderstanding there. And then we will finish off the year with our regular first Tuesday of the month at 10:30 for this committee. And then we will be sending out a poll to determine what it's going to look like for 2023. And I imagine that we'll have to send more than one out to really get a narrowed and defined calendar for 2023. But if you could just work with us and give us your feedback and your open and available times, I would appreciate that. At this time, we will move forward to agenda item number 7, which is going to be public comment number 2. Again, we can take public comment at this time, and I ask that in consideration of others that we please limit comments to no more than 3 minutes, and we should also try to avoid repetition. And again, we can't take any actions on any matters discussed in this agenda item. And yeah, I have Terry Kerns.
Thank you, Chair. I appreciate you recognizing me. I just wanted to add two things that I neglected to tell you before about our surge meeting. One topic that came up out of our subcommittees is harm reduction and where it fit in our subcommittees. Currently, we have it in prevention as a tertiary prevention measure, but there was a fear that prevention or harm reduction would have a lot of recommendations. So we didn't want to limit that. So because of that, we are going to, in the upcoming year, have one special surge meeting that will be dedicated to addressing harm reduction and talking about, where it fits in those items. And the other thing in terms of the joint committee meeting between the ACRN and the surge members very much look forward to participating with the impressive list of ACRN members. There's a feel from many of the surge members that much of what we're doing currently has been procedural or mid or longer term types of actions. So we really look forward to working with you on some more immediate action items. Thank you.
Thank you, Terry. Do we have anybody else interested in public comment number 2 at this time? I don't see any other hands up or mics unmuting.
Hi, thank you so much. This is Katrie Saunders. In the beginning, hi, how's everyone doing today? I was just wanting to make a public comment in regards to, you said there was an open position on the board. How do we apply for that?
Again, thank you, Katrie, for taking the time to address this committee. I did mention that the Nevada, what is it, Office of Equity and Minority Health and Equity is recruiting for this position. And again, I want to remind all the attendees that during public comment, we don't generally open it up for questions and answers, but I appreciate you getting clarification on that, Katrie, because if you're interested, I do want you to reach out to the Nevada Office of Minority Health and Equity to see about the posting for that recruitment position. So thank you for speaking up.
Perfect. Thank you so much for your time today. I really appreciate it.
Yes, ma'am. Do we have anybody else interested in speaking for public comment number 2 at this time? All right. Joan, do you see any hands or anything that I'm missing? Anybody unmuted? Okay. Going to move us forward to agenda item number 8, which is adjournment. This meeting has been recorded and we will get draft minutes out to the committee members posted on our website, which is the ACRN state website. If I have nothing else, this meeting is adjourned. Thank you for attending and thank you for giving us your input and showing up and sharing with us. Take care, everyone.